Good afternoon. Hi, everybody. Thank you to every one of you for participating in today's event. We are very happy to welcome all of you who have been with the PATOS for many years, as well as those who are new to this meeting. The PATOS was first initiated in 2013 to build up a population-based registry of injury patients in Asia. The mission of PATOS is to establish an injury research network and to integrate separately kept injury data in Asia into a standardized registry. In 2013, EMS directors and officials together formed the PATOS Clinical Research Network and opened expert meetings to develop an international registry of injury. Finally, the PATOS CRN developed a registry form as recommended by the WHO Injury Surveillance Guideline. The PATOS is continuing to expand throughout the Asian Pacific region as interested parties join the network from all over Asia. The PATOS CRN will try to serve as an important research initiative that helps prevent injury and improve its outcomes across the Asian Pacific region. Last year, the PATOS CRN distributed a phase 1 dataset to all the countries and institutions who are involving this research. Phase 1 data contains the epidemiological characteristics and clinical outcomes of almost 70,000 trauma cases collected from many Asian countries. Using this data, the scientists and EMS researchers from the countries are trying to publish a paper for a variety of topics. We have 5 committees: the Trauma Epidemiology and Prevention, and EMS Trauma Care, and ED Trauma Care, and Hospital Care, and Trauma System Monitoring. To date, about 50 proposals have been registered with each committee. From your efforts, I hope that these topics will be published soon, shortly, in many medical peer-reviewed journals. Now we are collecting phase 2 data on the basis of our experience from phase 1. Since the PATOS project, thanks to all researchers and scientists, we have collected more than 120,000 trauma cases, which is the biggest one of the world, and we have 12 countries are participating in this study. About 90 organizations and institutions have subscribed to the data entry website. I want to express my sincere appreciation to all of you who are actively participating in very difficult in these situations. Today marks our 6th annual research workshop, and I am proud to be able to host this meeting today. Because of COVID-19, we were unable to hold the offline meetings in this year. I am very sorry not to see you in person, but I am very pleased to have this opportunity to discuss the trauma care of each country with you online system under COVID-19 pandemic situation. The COVID-19, which began to pandemic worldwide from the beginning of this year, has changed so many things. Diagnosis, treatment, prevention of COVID-19 may be the most important critical issues in all countries and all of you, as COVID-19 has dramatically affected people's daily routine lives and cares. I think it may have changed the incidence and epidemiologic characteristics of injury, and EMS and emergency department and hospital trauma care. In the context of the pandemic COVID-19, we would like to discuss the injury epidemiology and trauma care in each Asian communities. We will still lack sufficient and enough and loved data, but it will be valuable to hear and discuss each country's situation at this point. So a very warm welcome to all of you, and thank you to PATOS network countries, China, India, Japan, Laos, Malaysia, Philippines, Singapore, Taiwan, Thailand, UAE, and Vietnam, and also Korea. Thank you very much for listening, and let us welcome. Thank you very much.
Hello, everyone. This is Tanaka from Tokyo. I would like to send air to all of medical profession who are still fighting COVID-19 infection. In Japan, the COVID-19 infection has reignited and it is still on the serious situation. How are you doing, your city? Even in such situation, I would like to pay tribute to the staff member for the ongoing PATOS meeting. In Asia, the occurrence of the road traffic accident following infectious disease is a very important issue. We hope that the PATOS meeting will help improve trauma and pre-hospital trauma care in Asian countries. I would like to congratulate the PATOS meeting on the occasion in the further development of the meeting. Thank you.
Hello everyone, I bring you greetings from Singapore and hope all of you are keeping safe and doing well during this COVID-19 pandemic. And my best wishes and hope that you have a meaningful and great engagement during this PATOS session. And we are all thinking of you from Singapore. Thank you very much.